A lot of us are sitting more. We have more sedentary lifestyles. We work a lot of hours. We're often too busy to get out and walk like we want to. Maybe after a long day of sitting, you don't even feel like walking. Well, let me tell you, I can totally relate. In this episode, I'm going to talk to you about sedentary lifestyles, talk about the benefits of walking, and introduce you to a concept you may not have heard of. Wait for that until the end. So, a little about me. I have a sedentary work life. Like I said, I sit all day. I calculated the other day about how many hours I sit. I sit about 9 hours a day. That's in one day, you guys. And only about minutes into my session, I start feeling aches and pains in my legs, my thighs, my ankles, blah, blah, blah. It goes on and on and on. At times, my legs and ankles even start to swell up due to lack of circulation. I'll even get muscle cramps and spasms. It can be pretty miserable. I do have a stand-up desk, and honestly, that does help, but I don't use it often enough. And then by the end of the day, you have a commute. I don't have a very long commute. A lot of you probably do. So it just really exasperates the situation. American Heart Association state that sedentary jobs have increased 83% since 1950. So it's definitely a problem. Johns Hopkins Hospital reports that this sedentary lifestyle is actually called sitting disease. Well, that makes sense. And according to them, 19-year-olds are sitting as much as 60-year-olds. You guys, there's got to be a better way. So basically, we just need to move more, right? That's what the statistics and the studies are showing us. And chances are your chiropractor, your primary care physician, your body, which is, if it screams to you like mine screams to mine, it is telling you you have to move. So walking can help you lose and maintain your current weight. It can reduce stress. It can lower blood pressure. It can increase your lifespan. Listen to this. Even just 11 minutes of walking a day can add almost 2 years to your life. That's great news. Walking is also good for your heart. It can burn fat. It improves blood circulation. It improves your mood. And we'll get back to this one in a minute. It cuts the risk of type 2 diabetes by 60%. It's good for your heart. And if you think about it, a sedentary lifestyle increases the risk of type 2 diabetes, cancer, and heart disease. So already we're starting to see a solution. Some of the solution is actually walking. So walking helps boost your mood. Have you ever heard somebody say, go for a walk and think about it? Well, there's a lot to that. Walking helps boost your mood because it increases blood flow and blood circulation to the brain and throughout your body. It definitely has a positive influence on your central nervous response system. So when you walk, you calm your nerves, which makes you feel less stressed. And who doesn't need more of that? You can build on the positive effects of walking by just inviting people to come with you to walk. Walk in different types of environments like this video is showing you here, or take your fur baby for a walk. It's all good. It's all fun. And then the physical exercise, which is combined with positive social interactions, can improve your negative moods, and it can ward off depression, and it can improve your self-esteem as well. There's this article that I read from NAMI, which is the National Alliance on Mental Illness. And the name of the article is How Walking Has Helped Me with My PTSD Recovery. So you guys, if you're struggling with some trauma, walking can definitely help you out with that. I will have that link down below. And walking just purely gets you places. So now I'm going to talk to you about my idea of walk and talk therapy. No, I did not coin this term. It's been around for a while, but it's very similar to traditional therapy where you come in and sit down and talk, except you guessed it, it's walking and talking at the same time. Bringing in that little bit of movement enriches the counseling session, and it just allows people to be more freer with their thoughts, their ideas, their creativity, and it helps them get unstuck. And there are times when sometimes when somebody comes in, they have a very difficult topic that they want to talk about, but they are very, very leery of doing so. This would allow us both to look straight ahead and we're talking and walking at the same time with lots of visual distractions that may be easier to bring some guard down and maybe easier for some engagement between the therapist and the person walking. Let's also not underestimate the healing power of being in nature. So it's obvious that positive things are going to happen when you're outside walking and talking at the same time. If you have a beautiful setting to do this, like a park or a paved path, it's going to make it probably a little bit better than walking inside. But in my office, I have 2 treadmills that I offer as a option as well as going outside. When I get people outside, it's so easy to be distracted. You're hearing a cow moo in the distance, you're watching some birds, you're seeing maybe some chipmunks or some squirrels play nearby and some birds, and it really just relaxes the whole atmosphere and the whole setting just becomes more casual, more comfortable, and it allows for further breakthroughs. There's also this thing that happens in therapy that most people do not talk about, and that is having uncomfortable eye contact. There may be times when you're bringing up, let's say, something super, super sensitive and you're feeling embarrassed or ashamed. Maybe some guilt feelings come in and you don't want to look at your therapist and you try to avoid the topic altogether. But a lot of times, that eye to eye, chair to chair, knee to knee, staring straight at each other can be very trying on someone and promote or provoke even higher levels of anxiety and maybe even some avoidance. So there might be some social situations that happen in a typical therapy session where somebody might not be comfortable with due to the fact of that type of setting. Well, again, if you imagine yourself walking and having these distractions at the same time, you might be able to become a little bit more vulnerable and be able to reveal things that you were not able to reveal before, therefore getting further help and again, getting unstuck. Now, it's important to note how I do this. When I provide walk and talk therapy, there are some confidentiality concerns that I need to mention. When you're in a session in an office, the door is closed, you have a noisemaker on or something like that, but you ensure that you have complete privacy. Well, when you're out walking about, you obviously don't have that. So we talk about that before we even start the walk and talk therapy session. What we talk about is what are we going to do if or when we see somebody? What are we going to say? But typically, these situations don't promote any kind of weird opportunities, I guess I should say. What happens is we look up, we say hello, we smile, and we keep on walking. We don't have to get into any details on what's going on. In my experience, it's been totally fine and not even the slightest bit problematic because somebody sees you walking with somebody else. How many times have you seen 2 people walking and you don't automatically assume that they're talking to their therapist? So, but if we do run into that, we talk about it ahead of time. We plan and prepare. So now let's say you're interested now. You're interested in knocking this out. I mean, who wouldn't want the best of both worlds? You can physically get fit, you can mentally get fit, you can work through some challenging issues. And hello, the people out there who are multitaskers like myself, like the idea of knocking 2 things out at the same time. So finding a therapist who offers walk and talk therapy can be difficult, but what I'm going to say is mention it to your therapist. Like I said, I was exposed to it a few years ago and I thought it was a fantastic idea. And then I tried to implement it. But then 2020 happened and a lot of things changed for a lot of us. But not all therapists will know about walk and talk therapy. So this is when you can come in and just say a couple things about it. In fact, wouldn't it be fantastic if this video created a walk and talk movement? Therapy talk, walk and talk movement. I can just hear it now. And sitting, you guys, is just so passive. It is just passive in our life and in our world. So it just makes sense that we would try to implement more walking and talking into our work day. So there you have it. There's my ideas on walk and talk therapy. If you are in my area and would like to have this happen, you know how to get a hold of me. And if you're in therapy, Ask your therapist about it. It takes no additional training at all. It is done just the same as any other therapy session, in my opinion. And at no point is this video saying that you need to get out there and walk, although it's good for you. But I do realize that we do have some challenges with getting out and walking. We might not be in a safe neighborhood, or we might have other things going on that affects us to go out and walk. I'm not saying that at all. Of course, you have to take your circumstances into consideration. But moving is moving. Even if you're moving from your refrigerator to your living room couch, to the back door, back around to the bathroom, it is walking. If you found some value in this content, please throw us a comment and a like and subscribe if you haven't already done so. We really appreciate you guys supporting our channel in attempts to destigmatize mental health. We cannot do it without you. So, bye for now.